when this COVID-19 pandemic struck us here, we were totally unprepared. I think nobody was ever prepared for this. There was an immediate reaction from the community because at that time people were talking that COVID was airborne, so classes were suspended. What initially we did was to consult our medical experts. The first thing that I did was hire a medical infectious doctor to guide us on what measures can be done in order that we will be able to answer the needs. Based on our experience, especially with the Zuellig Family Foundation, we were part of the program called the Provincial Leadership Governance Program, which seeks to strengthen the governance of the province and the municipalities in terms of health. That is where we expanded the Provincial Health Board to include already our municipal health officers, municipal mayors, in the planning and strengthening the health system of the province of Aklan. Furthermore, we were also fortunate that amongst the PLGP participants all over the country, CFF chose Aklan to represent the Visayas on its new program, which is the Integrated Provincial Health System and Development Program, in preparation for the Universal Healthcare Law. And so, the relationship between the province and the municipalities and barangays was further strengthened. And so when COVID-19 struck us, it was easy for the province to activate our provincial IATF. The basic structure was the Provincial Health Board, and we expanded this to include our private hospitals, private doctors, and our partner agencies like the DILG and the PNP for implementation. The structure was basically there already. The battle of COVID is really at the community level. When we established the contact tracing and established the quarantine or monitoring of possible suspects, it was easy for us to strengthen our BHERTs because of that strong partnership between the province and the local government units. We started crafting our own protocols. We developed our own systems on how to address. And when I declared the province under the ECQ, or Enhanced Community Quarantine, we had already some measures or some practices that will prevent transmission within the province. The digital platform that we developed is actually for a future tourist. Anybody coming to Aklan will have a seamless, hassle-free, contactless data gathering. We have a very active community wherein monitoring of suspects has been very, very effective. With a strong contact tracing mechanism, and we strengthened that by having a digital platform. All persons that comes to the province will have to go through a process of registration, a land-based registration, a sea-based and air-based monitoring. This will be part of our continuing efforts to prevent local transmission in the province of Aklan. We're fortunate that the ZFF was able to develop a tool for us called the COVID Tracking and Monitoring Tool for our repatriated overseas Filipinos, ROFs, and the locally stranded individuals, Aklanons. And so this system provides us the tool for monitoring also all of these LSIs and ROFs. I'd like also to emphasize that all our municipalities have their own Ligtas COVID centers, so that we were able to make the provincial hospital as a referral hospital where we constructed isolation rooms, we bought all the equipments, while we were preparing for the worst case scenario, we did a major improvement of our provincial hospital to cope up with this pandemic. The fear of infection was there because we did not have the PPEs. We produced our own PPEs while waiting for the PPEs that we ordered outside of the country. So we also developed a very strong partnership with our private doctors, private hospitals. And of course, our latest project of having our own laboratory, it's already almost for commissioning by middle of this July. The building is already constructed. We bought already all the equipments that are needed. There is now a training for our medical technologists, and once they come back, we will be able to start already with the initial test for the province of Aklan. We are very thankful to our partners, the Zuellig Family Foundation, ZFF, for the technical assistance that they have given us, and also for donations to the province in terms of our fight against COVID. All of these measures that we have put in place, monitoring, the tracing, the treatment, the provincial hospital is already quite prepared. This is part also of the strategy of the national government. We have the 3 T's. We have already a strong tracing mechanism. We have already a strong treatment mechanism because our hospital is now ready. And we have also the testing mechanism. So with these 3 T's, tracing, testing, treatment, I could safely say that the province of Aklan is already well prepared for any future eventualities. That this is also very important for the economic survival of this province. We were also affected economically because our structure here in Aklan is our provincial hospital and the 2 district hospitals are part of our economic enterprise department. The income that we derive from our tourism industry supports our medical facilities and hospitals. And so when this dried up, we could not also relax, or we could reduce our medical responses. We were one of the first destinations wherein the health and sanitation protocols were implemented. All the health protocols will be in place. It is safe for them to stay in Boracay because we have a very strong COVID response system in place, hassle-free, contactless. Our people are knowledgeable on what is to be done. Our local populace knows what is to be done by observing the minimum health standards. But as we gradually open up Aklan, the importance of having a very efficient monitoring tool for all incoming, inbound passengers, both sea and air, to go through this system. And so, with these assurances, we will be able to revive our economy. It is very important that we can also show to the rest of the country, to the rest of the world, that when we open up Boracay, we will show to the world how ready we are. We could say that we have been tested, but because of our cooperation with the support of all the local government units, our mayors, our barangay officials, our people, we have already established all the necessary controls, which we did not have at the start, with the support of everyone, from our medical doctors, from our provincial health offices, municipal health offices, and we have to continue doing this. We are just starting to open up our economy. We have to open it up because tourism is the lifeblood of the province of Aklan, and we have to be able to see to it that when we open our economy and when we provide the necessary jobs and opportunities to our people, we will also ensure that the health protocols should also be there. And I could say that we have successfully balanced it. We are prepared already to open up Aklan. We have just to continue doing what is best for the province, what is best for the family, what is best for the community, so that we will be able to survive this pandemic and come out more prepared in the future.